Hello, Elevation Health friends and family. Dr. Dave Yachter here. I want to share with you some important briefings as we approach our Heart Smart Nutrition workshop here very soon. And it's coming up fast, and people are registering like crazy. This is one of our most important, best attended workshops, and there's a good reason why. So today you're going to follow with me on, the major factors that really contribute to and accelerate heart disease, making it the #1 disease killer. And these are things that many of you are likely doing because of misinformation you've received from your friends, your family members, and even family physicians. And unfortunately, they're all causative factors for promoting heart disease and early death. And so the reason why this is important is every 37 seconds, a life is lost to cardiovascular disease. So for most of you watching this, it's 1 out of every 2 people you know, including you and including me, if we're not up on this and being proactive and preventative. So let me talk to you about these factors. And the first group of people that I want to talk to is those of you who are under my care right now, in particular, that are taking medication for heart conditions. So high blood pressure, cholesterol, atrial fibrillation. So many of these common conditions that we take for the heart are mitigated or seemingly controlled by medication. So I've had many people say to me, well, I see here, I'll say to them, I see here you're on medication for this condition or that condition. No, it's not a problem. I don't have that issue anymore. Well, you're on the medication for it. Yeah, I'm on the medication, but it's not a problem anymore. I don't have high blood pressure. My cholesterol is in normal range. Okay. Well, that's good. But the question always I ask myself is, did the medications actually correct the cause of the condition, or did they just control the effects? And this is a really important consideration, because if you're one of those folks that are taking medications for a heart condition, you need to understand that those medications did not cure you. Those medications did not correct the cause of your high blood pressure or your cholesterol or your atrial fibrillation or whatever condition that you have regarding your heart. And even if it's taken for preventative measures, I'm not going to tell you to stop taking medication, but the first consideration is #1, it does not correct the cause of the problem. So if you're driving your car down the road and there's a flashing engine light that's telling you that, hey, there's an issue going on, and you just put black masking tape over it and you don't see that anymore, doesn't mean that you don't have a problem. It just means that you can still live your life without that annoyance. But what lurks beneath the surface and what's happening as your body still has to deal with that condition or the cause of that condition while the effects are being controlled, your blood pressure is artificially being put in normal range, seemingly. Your cholesterol is artificially, with a cocktail of pharmaceuticals, being put in normal range. You have to ask yourself, how is my body dealing with this? And what are the negative consequences potentially long-term? So that's the first consideration. So that brings me to my second consideration is if you are taking medications, that there are effects. Now, I don't like to say side effects because medications just have effects. There's no such thing as a medication that doesn't have an effect. For every medication that you put in your body, there's an equal and opposite effect negatively somewhere as the body has to deal with that, which is not natural, that comes into your body from the outside. So, for example, cholesterol medications. We know for a fact that it affects the mitochondria in the cells. That's why people have fatigue. That's why people commonly describe symptoms of brain fog, forgetfulness, joint pains. And I'm sure you've heard a lot of this. These are very common side effects. And you may have this, or maybe you don't have that. And that's not the concern. The concern is how is your body dealing with this as we're putting artificial ingredients, artificial pharmaceuticals, synthetic chemicals into our body over not just days, months, but really years or decades. And because again, this is cumulative and it builds up in our system and it affects things eventually. Very few of these drug companies have done long-term studies, and we should know this by now. Most of these blockbuster drugs that come out that our physicians put us on have been short-term trial studies that have been shot-putted through by the FDA. Long-term studies have not been done on these things. And many of these black boxes, they have black box labels on these medications, and your family physicians are not alerting you to this. They're just saying that you can take it, it's safe, it's been approved. Well, in the end, who's responsible for your health? Who's responsible for my health? You are, and I am. We're responsible for our own health. We can't outsource that to anyone. You have to get the information and make a decision based on what you believe is best for you. And again, this is the reason why I'm bringing you this information, and this is what we comb through very carefully at the workshop. Now, I don't have time to get into the details and all the research that's been published in medical journals, and this is what I bring you at the workshops, but be assured that everything that I'm talking to you about is very real. Again, whether you are having these side effects or not. And many of the other issues besides the neck pain or the back pain that brought you in, or the leg pain or the sciatica or the headaches that brought you in, you've got other issues going on. And whether it's, migraines, headache, fatigue, insomnia, these are very, very common. And you may not think that it's related to the medication, when in fact, it very well could be effects from these prescription drugs. So this is something that I want you to think about. And again, another reason why you should be looking to be at this workshop coming up here, this Heart Smart Nutrition workshop. And then, for this not only is considered for cholesterol medication, but blood pressure and also atrial fibrillation and every heart condition medication that you can think of. If you're a patient being treated for a heart condition and you're under my care, this has to be considered. Please listen carefully. And then last and least are those of you who are watching right now who are not taking medications for any heart condition, who don't seemingly have any symptoms, which is good, at least for now. But we always talk about, and you know this and I know this, is that the absence of symptoms does not indicate the presence of health. And we know plenty of people, and we've heard plenty of stories of those that we've known, maybe family members or friends, and they felt fine and they went for a doctor checkup and their body was riddled with cancer, and they died within a short period of time after that. And they felt great, never had a pain in their life. And then we've heard of those people that were athletic, they were thin, they were seemingly healthy, and then they dropped dead, out on a run or playing basketball unexpectedly. My question always is that these seemingly healthy looking people, 10 minutes before they dropped dead, were they actually healthy? And of course, we know the answer is no. So again, the point is that the absence of symptoms does not necessarily indicate the presence of health. Just because you have no symptoms, it doesn't mean that your body's functioning at 100% or is actually healthy just because you don't have symptoms. And one of the things that we're going to unpack at this workshop is a new dial on your dashboard, really a new gauge on your dashboard, which is really going to tell you if you're in harm's way, if you're in imminent danger of high blood pressure, kidney failure, non-alcoholic fatty liver disease, obesity, diabetes, and cancer. And you need to be at this workshop to learn what this is. And I'm going to talk about this. There's stunning research that's been published in the last few short years. And I can almost guarantee that your medical doctor has not briefed you on this and talked to you about this. So I am looking very much forward to sharing this with you so that you can look at this, be aware of this, and make sure you're on the cutting edge and way ahead of any diseases that perpetually or potentially could affect your quality of life. And if you do have any health conditions right now that I have just mentioned, and you're not getting results with them, this could be the missing link. So you need to be at the workshop to discover this, to learn about this, and to learn where to look and what to do to get things under control. That's all I'm going to say about that. The workshop is coming up September 12th at 5:45. You can get all the answers to this, as well as how to reduce your risk of heart disease by 90%, get better control of your blood pressure, your cholesterol, reverse type 2 diabetes, and learn about the most powerful heart healthy foods and nutrients So you're going to learn all about this at our Heart Smart workshop coming up Monday, September 12th at 5:45. Seating is limited, so please make sure you get yourself registered, and your friends, family member, whoever your guests are that you want to bring, get registered now. If you're sitting in the office on the wobble chairs, wherever you're at, walk up to the front desk, get your names down, because it's first come, first serve, and it's filling up fast. Thank you so much for joining me today. I love and appreciate you. God bless.